Welcome to the Point, presented by SSM Health Monroe Clinic Medical Group. I'm Kent McConnell, and today we are visiting with Dr. Sunil Penesetti, preventative cardiologist at SSM Health Monroe Clinic Medical Group. Doctor, welcome.
Thank you. Thank you for having me.
Today, Doctor, we're talking all things about heart health. As a preventative cardiologist, would you be able to share with us what that entails and why a person might visit you?
So historically, we visit doctors after bad things happen, particularly in cardiology. It's after you have your heart attack, after blank hits the fan, and then you find out that you have a lot of blockage, and it's almost too late at that point. Or if it's not too late, it could have been treated better. And so preventative cardiology is kind of like a time capsule. It's like going back in time before the bad thing ever happened in the first place and finding out exactly how at risk we really are. For example, for having a heart attack, how much plaque do we really have in those arteries? Are we at high risk? Are we at low risk? And having that information makes us better patients.
Doctor, as a big contributor to heart health, why is it important to control your cholesterol and blood pressure?
So there are multiple cardiovascular risk factors, right, for what can lead to plaque deposition in particular. So when arteries of the heart get plaque buildup, that causes the arteries to narrow, which can compromise blood flow to the heart muscle and cause heart attacks. And so our goal is to prevent that plaque from sticking on to those arteries in the first place. And so how do we do that? Keeping the cholesterol in our blood low is going to be one of those things, keeping the blood pressure down. But it's not just blood pressure and cholesterol, right? It's living a healthy lifestyle, being active, having the proper diet, preventing diabetes, or if you have diabetes, keeping that under control, relieving stress, which is very commonly underrated. So all of these things in conjunction can help us prevent plaque deposition in the arteries, which cause heart attacks, and not just plaque deposition in the heart arteries, but in the neck arteries, which cause brain attacks, i.e. stroke, or arteries in the legs. So medications like statins, for example, can really help us do that, but that in itself is not enough. It's all this stuff, controlling the blood pressure, the cholesterol, the diabetes, the stress, all these things in conjunction can prevent blank from hitting the fan.
We're visiting today with Dr. Sunil Penesetti, part of the cardiology department at Monroe Clinic Medical Group. And doctor, with your specialization in preventative cardiology, that seems like something we should all be working towards, preventing heart problems. Now, you made mention just a second ago about some of the things we could do, but what are some lifestyle changes that can be made to help strengthen heart health?
So what I always tell patients is start low, go slow. You can ask anyone on the street what they need to do to live a healthy lifestyle and diet. So everybody knows the what, but the question is the how. And how do we really execute, right? And so what I always tell patients is to not have big grand goals. I mean, it's one thing to say to yourself after New Year's that you're going to work out 2 hours a day every day, but at some point we give up, right? And we lose our motivation. So what I always tell patients is, for example, a strategy would be to start with just 5 minutes a day. And whether that is a treadmill in the house or an exercise bike in the house, which I really encourage, especially in this cold climate. I don't know about you, but I don't like driving to the gym on a cold February morning. So having things like that readily accessible and starting with 4 to 5 minutes a day. What that does is it tricks our brain. It tells us, hey, I don't feel like working out, but I can do that. 4 minutes, 5 minutes, I can do that. It's got to become habit where it's almost like brushing your teeth, where nobody really cares if you feel like brushing your teeth. You kind of just do. And so the bigger thing in terms of execution is it's trying to develop a pattern of consistency.
I know myself, when I go out and I take my nightly walk and things like that, if I don't do that, I really miss it, and there are times, like you said, that you just don't feel like doing it. But if you don't do it, then you certainly miss doing that. And like you mentioned, it becomes a habit.
Exactly. And really, that's what we're trying. And that's what I emphasize to my patients. Now, if your 5-minute workout becomes a 9-minute workout, great. If it becomes a half-hour workout, great. If it becomes a 12-hour workout, fine. But really, what I care about is that you're on it 5 minutes a day, every single day. And like I said, what it does is it tricks our brain into thinking, okay, I can do 5 minutes. I mean, I'm tired and I don't feel like it, but 5 minutes I can do. And it's a way of just training the brain.
Something we hear a lot about is how smoking impacts your heart. Can you give some insight on how quitting smoking, or vaping for that matter, can help your heart?
So, like for this interview today, my focus is not as much on the what. We all know the what. We all know we got to stop smoking. We all know we got to exercise. We all know we got to eat healthy. We all know these things, right? But the question is, how do we actually execute on these things? So for the exercise, like we said, 5 minutes a day, that psychological trick gets us moving. And when it comes to smoking, what I would say is think about the people around you. So if you have children, grandchildren, think about that the next time you pick up a cigarette. And if you're 59 years old and you're okay being in a wheelchair when you're 71 and kind of being on the sidelines at your granddaughter's graduation, then you should smoke that cigarette. But when you think about the repercussions of things, sometimes that makes us think twice, and that's not just with smoking, that's with eating healthy too. That hot fudge sundae, I mean, if you're okay feeling like crap 3 hours later for the rest of the day, you should have that hot fudge sundae. And sometimes that hot fudge sundae is worth it, but sometimes it's not. And so the technique that I try to discuss and, kind of train people with is think about the consequences. And I've had more people stop smoking when they can think about that. And they wake up one morning and they just say, you know what, I'm done. And I still think cold turkey is better than all these other sexy techniques like vaping and all these pills and patches and things like that. Now, there are some people where it does help, but what I would say is if we get a theme out of today's interview, it's a mindset change. I know that's a long way of answering your question, but obviously if I can get you to stop smoking, there's nothing better.
You mentioned stopping smoking cold turkey. Now, over maybe 22, 23 years ago, I quit smoking. And it was one of the hardest things that I ever did. But I quit cold turkey. And actually, at the time, I didn't realize, how much of a hold it had on me. But I always figure that if I have one more cigarette, I'll go back to it. So I am a strong proponent of cold turkey. I know of numerous people out there that just say, well, I'll start by cutting back. And I don't know that has ever worked.
Well, what about your friends around you, these patches and these vaping and all these things? Have you seen it work with people around you?
No, I haven't. They just continue to smoke or vape or whatever the case may be. They just, I guess, don't have that willpower. Now, that being said, they've reduced the amount that they're smoking, but they haven't stopped.
Right. That's a huge start too. But ultimately, I always tell patients, if I could get you to stop smoking and you never see me ever again, I would rather do that than have you still smoke and see you every 6 months. Now, that may not be good for the business or whatever, but that's the God's honest truth. So I just want to emphasize to the people out there who are smoking, if we can get you to stop smoking and find a way to kind of dial into that, there's nothing better.
Doctor, if any of our listeners think they should be making an appointment with you, what should they be doing?
Anyone has any concerns about their heart health, they can make an appointment with us and call us directly. Our number here is 608-324-2227. That's 608-324-2227. In addition, I see patients in Freeport as well on Mondays. So whatever is most convenient, but between Freeport on Mondays and Monroe Clinic from Tuesday to Friday, we're here, whether myself or my colleagues, we're here to help.
Dr. Penesetti, thank you for being with us today.
Oh, anytime. It's always fun.
We've been visiting today with Dr. Sunil Penesetti, preventative cardiologist at Monroe Clinic Medical Group. I'm Kent McConnell for Dr. Penesetti. You've been listening to the Point, presented by SSM Health Monroe Clinic Medical Group.